Hi, I'm Dr. Matt. Welcome to this week's Cornerstone in Health. We've had a lot of questions about our new technique, QSM3, stands for Quantum Spinal Mechanics in 3 Dimensions. It's an awesome technique. A couple things I really like about it. One, it's measurable, so I can measure before and after the adjustment, which we do. And then there's also there's a formula for getting people better. We want to get the twist out of the spine. That shows compression. Then we want to balance the spine from side to side so that you're walking in a balanced way. Then we want to get the weight even on either leg. And then we want to stand you up straighter, restore the curves in the spine, which is so important for tensegrity, keeping you up and open and strong and able to fight up against gravity with the least amount of effort, freeing up more information for your brain to process, freeing up more information for you to have a good life. And then lastly, we want to get everything stable. So Tracy, I'm going to have you come around here and stand behind us. We're going to measure up Dr. Travis here today. And we have Dr. Travis on the scale. We can see that he is about 10 pounds off on his right leg. Okay? And then we can use the lasers here to assess his posture. Very good. And we can see that Dr. Travis's shoulder is low on the right. His neck is shifted to the right, and then we're just going to look at the head. His head is to the right too. So those are the 3 things on the top I measure which show the neurology. That, we call it neurology because it's closer to the brain and because it balances out the biomechanics. It is what moves to compensate for old injuries you've had, problems you've had with your pelvis and low back. Now we're going to look at the low back. One of the big things we look at in the low back is the weight, and as we said, Dr. Travis is heavier on the right, and he shifted right. So I'm going to look at which hip is lower on Dr. Travis. We can see the right hip is lower, and then I look at the fixed point. And what the fixed point is the center of gravity of your spine. It's a fixed point because on x-rays it doesn't move. And it's the TP of T1, or the center center of the body of T1. And I'm going to look at that compared to L5. So his fixed point should be right over top of L5, or in this case it's shifted to the right too. So everything on Dr. Travis is shifted to the right. So we're going to get him down on the table. Hang on one second, Dr. Travis. I'm actually also going to measure the twist in his spine, because twist shows compression. Whenever there is twist, that's what's going to be causing the pain and achiness in your spine. And his spine is rotated back about 6 millimeters. And it is rotated forward on the top about 6 millimeters. So Dr. Travis has what's called the dish rag action going on. His hips are back, his shoulders are forward. So we want to get him in a table on a mirror image of what we wanted to accomplish there. So I'm going to have you lay it right side up, Dr. Travis. Okay. I'm going to put these back. I'm going to put this forward. There we go. Very good. We're going to bend the knees. And then another key component of this is the headpiece, making sure it's in the proper place. My goal here is to put Dr. Travis in a mirror image of his misalignment. So gravity is working already to make the adjustment, so I have to use less force. Now, there are 14 keys on either side of your spine. 14 places where the big muscles of the low back, muscles of the shoulder, the muscles of the neck all attach. The spine's processes look like this. These are the things that I'm going to grab a hold of with my wrist and move up and back to where they're supposed to be. So I'm using the leverage biomechanically that God already put in our bodies to realign it. And because I'm able to use leverage, and we're very good at doing these adjustments, I don't have to use a ton of force. Now for Dr. Travis it's going to be sensitive because there is some dysfunction in these areas. So we want the function to return, but it's relatively comfortable for the patient. A lot of people say, well, how is this doing anything? You're just pushing on his neck or giving him a massage. I say it's a cross between massage and brain surgery, because we're affecting the neurology by what we're doing with the connective tissue, with the structure of the neck, and with the nerves. So I'm finding each vertebra in his neck has a specific attachment. I'm assessing each one. When I find a problem, I'm relieving that pressure, relieving that problem. And you do need to repeat the process a few times just because it's more comfortable for the patient that way and because the body accepts it on different levels. So I'm actually tractioning the low back, the neck, and the mid back when I'm doing this in order to get Dr. Travis more up and open and receive that adjustment. So there's 14 keys, 7 spinous processes and 7 transverse processes, and I check each one, make sure that they're up, open, bending the way they need to. Each patient's neck is like a keyboard, and my job is to play the song that opens everything up. Playing those 14 keys and finding the spot at which Dr. Travis will eventually pop open and be at his perfect posture for the time being. This technique is great for chronic pain, chronic dysfunction, disc issues, anybody that's an athlete or wants to perform at their best. It's obviously great for pain. There's been great studies and great research on its effects on blood pressure, its effects on Parkinson's disease, anecdotally, its effects on lots of different neurological conditions like trigeminal neuralgia, paresthesia, neuropathy. This technique's been around for about 5 years, but it's based on a technique that's been around since the 40s. And it's quite a bit of advanced training needed in order to perform this procedure. And we are currently the only chiropractic clinic in North Dakota offering it. The reason I wanted to offer it, you can go ahead and get up, Dr. Travis, get back on the platform, is because when I was living in a bigger city, I would have this procedure done. And I always wanted to have it done myself. I wanted the opportunity to get this treatment myself. And so the best way to do that is to learn how to do it and bring it to our town. So Dr. Travis was 10 pounds heavier on the right when he first started. Now he is fairly balanced. He's actually shifted a little bit more weight to the left side, which is awesome. That's better than perfect. We can see here, before, his head was shifted right, shoulder was right, and his head was right. And it's relatively on center now, but it's slightly biased to the right still, which is good, because I want that head, the right to be balanced by stuff on the left. Okay? So now we see that fixed point, that center of the body at T1, is shifted to the left. I'll move this so you can see it. That shifted to the left, subtly. We look at the low hip here, and we can see that shifted to the left as well. And as I already stated, the weight has shifted to the left a few pounds. So that's awesome. We're going to measure the rotation to make sure that that's gone back to normal. Normal weight is within 3 pounds leg to leg. Normal rotation is within 3 millimeters. And Dr. Travis was several millimeters off before. Now he is within 4 in his pelvis. And he's within 1 on his shoulder, and they're both on the same side. So before, Dr. Travis had that dish rag thing going in his spine, twisting his spinal cord, twisting his neurology. And now it's much reduced, and it's actually coplanar or on the same side. So Dr. Travis is going to have a much easier time dealing with the effects of gravity, a much more open opportunity to enjoy and express life. I'm Dr. Matt. This has been your Cornerstone in Health. If you like what you see here, please hit like, please share. We'd love to know what you're thinking, so go ahead and leave a comment. I'm going to leave you with these words of wisdom. The best way to make the world a better place is to make the most of yourself. Thank you, and we will see you in the next video.